I realize I have spent a lot of time on recent shows talking about the Miami Center for Mental Health and Recovery, but it really is important. And let me tell you why. First, it was promised to voters back in 2004, and the idea behind the center is a simple one. Take mentally ill individuals out of the jail and move them into a place where they can receive comprehensive treatment and support. The county has already spent more than $50 million renovating the building, and funding for the first 2 to 3 years of the center is already in place, and yet the center remains empty, not helping anyone. But there is another reason why I think this story is important, because it shows just how dysfunctional county government can be. And while several county commissioners have raised questions about how the center will be funded in future years, no one has been more outspoken in throwing up roadblocks designed to keep the center from opening than Commissioner Danielle Cohen Higgins. Earlier this month, she made a motion demanding that before the center can open, the mayor and others must identify at least 10 years worth of funding.
I would like a motion to direct the administration to prepare a 10-year financial projection, find the money in our budget, specifically identify what you are not going to fund in order to fund this building, and bring it to us in the form of a report at our next committee hearing so that we can review it and actually deal with the numbers of the Lifeman building.
It wasn't on the agenda, the public wasn't informed in advance, and it passed without any discussion. Now, on its face, what she proposed may seem reasonable, but that's really not how the budgeting process works. Commissioners don't require the mayor to announce today what program she's going to cut in 4 years to pay for the senior meals program in 2030, or ask how many people will she lay off in 2035 to fund the Parks Department in 9 years. Now, in response to Cohen Higgins' maneuver, the venerable downtown publication Miami Today accused her of offering false praise for the center while trying to bury the project in red tape. The paper argued the commissioner, who is up for re-election this year, was attempting to put nails in the coffin of a center that has wide support by creating an insurmountable barrier that no other county project has ever faced. So let's hear from the commissioner herself. And as we go, we can try to understand what she is saying. Tell me where you are right now as it stands with the mental health center and getting it open.
I understand the urgency, I understand the need, and I understand what the voters voted for way back when in 2004. And I've watched your reporting closely on this, and I appreciate you covering this because it's a very important issue to our residents. I believe that the center needs to be opened. Frankly, I'm extremely disappointed that this project has been worked on for the better part of 20 years. And when it was initially presented to us in committee review, a 20-year workup was presented to the committee with only 2 years funding. That is of great concern for all of the committee members. And so we want the hard work to be done on the front end, i.e. identify where this money is going to come from in order to fund this important project. And I think we can get there. We just don't want to leave it up to chance. And I said this at the committee hearing. I think you're telling us to just trust you that you'll figure it out. We don't feel comfortable with that. Again, we're talking about lives here. We're talking about mentally ill patients. Currently, the funding proposal is only at 75 beds out of the 250. Can you imagine, Jim, if one of your loved ones is sitting in that center on treatment and 2 years in, or at whatever point the funding runs out, you get the information that your loved one is going back to our correctional facility? That is a tragedy we are trying to avoid. We believe the funding...
Yeah. Except that's not the way that would actually work. That's not the way it would. This is a diversion program so that people who are coming into the jail are diverted into this program. And you're right, there's 75 beds. It's a 10-bed crisis stabilization unit. And then there's another level, and then a level above that. And people are moving in and moving out. So it's not as if the center is full one day and then funding is over and everyone gets shipped back to the jail. What you would do is, and I think this was even brought up when you raised this point before in one of the committee meetings, it would be phased out like any program would over a period of time, and you would just stop sending people, new people, into the facility. So it's not like you would take the existing people who are at the center and throw them into a jail cell. It's that you would stop sending new people into the center and it would phase down. But that's only if the concept isn't proven. To your point initially, the reason it was 2 years, as I understand it, is that this is a pilot program to see if it works. And if after 2 years it hasn't proven itself, then it shouldn't continue. But if it has, then it can continue.
Yeah, so I hear what you're saying, but I was present at that committee hearing, and the response that we received was, and I quote, "We would just send them back to the jail." So I'm not sure what you're referring to, but we have said time and time again that after 2 years, we want to make sure that our mentally ill population and patients are not abruptly interrupted in their care. So what you're articulating regarding a phase in, phase out approach sounds far more agreeable and accommodating. But at the hearing, when the question was asked regarding what happens at the end of the 2 years, the funding runs out, because it's a proposal currently for only 24 months worth of funding, that we would just send them back to the jails. That's not something anybody is comfortable with doing.
Okay, let's pause here and go back to that Appropriations Committee meeting last December that she's referring to. Commissioner Raquel Regalado did in fact say if the project didn't work out, we would just send them back to jail.
What happens to the population of people that are receiving treatment and potentially residing in this building should all of the hypotheticals
They go back to jail.
not work out? They
They go back to jail. That's where they're at now.
Okay.
I mean, in theory, worst case scenario, they go back to jail. That's where they are now.
Commissioner Regalado was wrong to say that. She misspoke. I think she was frustrated by Cohen Higgins' repeated questions. Essentially, what Regalado was trying to say was that if the program ends after 2 years, the jail goes back to doing what it is already doing right now, warehousing mentally ill people. But where Cohen Higgins appears to be somewhat disingenuous is that despite Regalado's mistake, she was then given the correct answer a moment later by the county staff, who explained that no one would be sent back to jail.
If it doesn't work out, is that what happens? We just pack them all up and ship them back to corrections?
So what we will do, if it doesn't plan out, we would scale down. And I think that's the important piece of having this clinical provider, West Care, where they have outpatient services. So they continue to provide the support to the population. So it would be scaling down.
Okay, so not necessarily removing everyone back to corrections.
And yet, more than 4 months after that meeting, she continues to make this false argument that if the program abruptly ends, a building full of vulnerable mentally ill people will be closed and the residents will be cruelly tossed back into jail cells. She makes it seem like this building will be some sort of permanent condo for paranoid schizophrenics, and once they go in, they don't come out. The program is designed for small groups of individuals to enter the building, get the treatment they need for up to 90 days, and then they are transferred to other programs who help them with their transition back into the community by finding them housing and making sure they get the follow-up care they need. Once that happens, the county's responsibility for them ends. Cohen Higgins knows that, or at least she should. But for the sake of argument, let's say this program financially can only last for 2 years. Judge Steve Leifman and others believe the program will not only save lives, but will also save the county money. But let's say he's wrong. And let's say in the future, county commissioners decide that instead of prioritizing helping people with mental illnesses, they would rather spend money on rodeos and parades and all the other things they find funding for. In just those 2 years, this program will help between 500 and 600 people with mental illnesses get the treatment they need, treatment that has been denied to them up till now. So while commissioners are worrying about where the money will come from in the future, people who are struggling today aren't getting any help. But let's go back to my conversation with Cohen Higgins and her concerns about the money in future years.
We're receiving a lot of different information, Jim. We're being told it's going to save millions and millions of dollars. But when we ask for the savings to be shown in writing and on paper, because if you're reviewing this, and I know you have, show me where the savings are effectuated and actually coming to fruition in black and white ink. We haven't been shown that. So it's a lot of talk and no actual evidence to support what's being communicated to us. And listen, our reps put us in office to manage their tax dollars wisely. When this passed in 2024, 2004, the voters said that they wanted efficient, cost-effective care for our mentally ill as they're waiting trial. We're trying to make sure that the cost-effective component of that is being respected, and that's why we're asking the tough questions now, Jim.
Isn't that the point of a pilot project? Isn't that the whole point of why they presented to you a 2-year plan as opposed to what was initially a 5-year plan, and now you're asking for a 10-year plan? But in proposing a 2-year pilot program is to get the very answers you're seeking now. I guess the concern seems to be that you seem to be, it comes across to many that you are killing this project with kindness, that you keep asking questions about, well, what about this? And can we get that? And while you keep asking all these questions, you've got a building that you've already spent more than $50 million to renovate, sitting empty, costing the county and county taxpayers $1 million a year to have an empty building sit there without any program going through it and without the mentally ill individuals getting the help that you agree they need.
I couldn't agree with you more, Jim. And I got to understand where it is that you're coming from, because both can't be true at the same time. We can't argue that we spent $50 million and we have to respect the vote of our residents from 2004. And then at the same time say it's just a pilot program and we're only going to fund it for 2 years. We're either going to pull this trigger and we're going to adopt this method in Miami-Dade County, or we are not. We're either going to honor the will of the voters back in 2004 and respect the $50 million investment that we made, buckle down and fund this thing into the future, or we're just going to treat it like a pilot program. Since I've been in office, we have not done pilot programs regarding people's lives and their mental health. It's far too delicate of an issue.
See, now you've confused me again, because I'm with you when you say you want to be a good steward of tax dollars, and that's what your voters voted you to put in there. And so the argument has been by Judge Leifman and by the sponsor, Raquel Regalado, Commissioner Regalado, that let's see if this works. We believe it will work. Judge Leifman's career in looking at this population, he believes this will work. But like with anything, you can have a belief that it will work and maybe it won't. So rather than commit for the entire future that regardless of how the first 2 years go, we're gonna fund this thing for 10 years even if it doesn't work, seems irresponsible. So wouldn't the more responsible thing to be to say we have funding for 2 years, largely coming from the opioid settlement money, so that money's in place. We have grants and other money that's been committed, some of which is going to run out because the center won't open this fiscal year, more than likely, or this calendar year even. Wouldn't it be better to actually see if it works?
Yeah, so I think that we're having a disconnect on what we see as it working. I think the commission has bought into the concept. I think in our community even voted and said our mentally ill population has no business in our prisons, and that's not the appropriate place. If we can get them the mental health that they deserve and that they need, let's provide that in Miami-Dade County. I think that concept has been bought in. What the question is regarding whether or not it works is whether or not it provides savings to Miami-Dade County. And so I'm saying from a value proposition, I believe it should move forward and open irrespective of whether it yields savings, because it's a social service that our residents need and our voters voted on back in 2004. And that's where there's been a lot of disconnect. And so we are questioning this. We are trying to move it forward. There's not killing it with kindness, as you describe, Jem. I think we're doing the thing that our voters tasked us with doing and the residents of Miami-Dade County frankly deserve, because frankly, in 2 years after this pilot program ends, is it a coincidence that the sponsors no longer going to be on the dais? The ones that are going to be on the dais are going to be left holding the bag. We want to make sure that the funding is in place. This concept that we believe is going to be helpful to our residents of Miami-Dade County can continue well beyond the 2-year pilot program that's being proposed.
Next month, the County Commission will hold a workshop. It's at least the second or third they have had on the Mental Health Center, where they will continue to talk about how important the center is. We'll see if that talk turns into action. Now, I should note Commissioner Cohen Higgins and I also discussed the urban development boundary line and her efforts to hold Amazon accountable for pulling out of South Dade after getting a no-bid land deal from the county just a few years ago. I will post that part of the interview online for you to see. You'll find it at cbsmiami.com.